Hello and welcome, everyone. So glad that you can join us for today's conversation, Measuring Health and Rights in Humanitarian Settings. I'd like to start off our conversation today by just introducing myself. For those of you I haven't met, my name is Jessica Fern. I use she, her pronouns, and I'm the Director of Global Health Impact here at CanWatch. I want to welcome all of you here from wherever you are joining. Currently, I am on the unceded traditional land of the Algonquin people, as well as many other Indigenous nations known colonially as Ottawa. And so welcome to all of you, wherever you may be in Canada or abroad. Today is the last of our collaborative critical dialogue series, where we have been bringing together partners from the Canadian Collaborative for Global Health to talk about not only their individual work, but also these larger macro scale issues. And we're really excited to unpack these in a more comprehensive way. For those of you who aren't familiar with the Canadian Collaborative for Global Health, or what we just call the Collaborative, this was a project that ran for the last 2+ years, specifically designed to create innovative or to foster support for innovative solutions to data-related challenges in the space of global health and gender equality. So working together with 9 diverse projects and partnerships from partners including academia, civil society, private sector, Canadian and global partners. Each of these 6 projects looked specifically and uniquely at data challenges within different contexts. And so we're joined here today by colleagues from Sick Kids in Toronto, who will speak more about the work of their lab, but also speaking more broadly to the issues that they have unpacked in their work. We know that across the diverse and continually changing humanitarian landscape, one consistent challenge is measuring impact and change. When the impact that we are trying to measure specifically relates to health and safeguarding rights of women, adolescents, and girls, that challenge is even greater. So I'm quite excited to hear from this group what they found through their work and where we can go from here. So before we turn it over to them, I'd like to do a very quick introduction to our 3 colleagues who will be speaking with us. So Dr. Diego Bassani is with us. Diego is the Senior Scientist in Child Health and Evaluative Sciences at Sick Kids Research Institute, and also an Associate Professor at the Department of Pediatrics at the Dalla Lana School of Public Health. Dr. Bassani is also the Director of the International Program Evaluation Unit at the Center for Global Child Health, and currently leads the evaluation of international programs of large Canadian NGOs in the areas of maternal, newborn, and child health. And he led the collaborative initiative that we'll be speaking about today. I'd also like to welcome Celine Goulart, who is a clinical research project coordinator at Sick Kids Hospital. Prior to this, she also supported data analysis at Population Council in the US, as well as the Krembil Research Institute at Toronto Western Hospital. So welcome, Celine. And then last but never least, Amanda Joncola is project coordinator at Sick Kids Hospital, and she served as the clinical research project assistant for this collaborative project. So welcome, Amanda, Celine, and Diego. And thank you, MIN, for sharing the link in the chat. If you'd like to learn a little bit more about the details of this project later on after this webinar, feel free to go and check out the links that we've shared on our website. But nothing beats actually hearing it directly from the folks involved themselves. So I'll turn it over to the 3 of you. And to begin, perhaps you can tell us a little bit about the lab project that your group undertook over the past few years, what some of the primary areas of inquiry were, and what emerged from that work.
Thanks, Jessica. Well, so as Jessica so well explained just before, we really started this project because the measurement of rights health, and women's empowerment really are not very well, it's not very easy to conduct this in LMICs in general, but also especially so in humanitarian settings. There are a number of limitations and challenges, including limited access to health services due to displacement and conflict. And so we really wanted to see what the literature said about all the different toolkits, indicators, and measurement methods used to measure both sexual and reproductive health and rights, as well as gender equality and women's empowerment in these settings. So what we did is we went about conducting 2 scoping reviews, one more focused on the health aspect, so sexual and reproductive health and rights, the other on gender equality and women's empowerment in these settings. And these reviews are very interrelated, as sexual and reproductive health is really, a part of gender equality and women's empowerment, as it's so important. And so some of the resources from both papers really kind of were transmitted between the two, as they were so interconnected. So I'll speak first on our first scoping review, which was on sexual and reproductive health. That was a much larger review in terms of what we yielded. We found there were 385 publications and reports related to the measurement of sexual and reproductive health in humanitarian settings. Within that, we categorized indicators into 9 different domains. So those were abortion, antenatal care, family planning, gender-based violence, HIV and sexually transmitted diseases, maternal health, maternal mortality, menstruation and gynecological health, as well as obstetric care and delivery. So from that search, we found that 65 toolkits and questionnaires were used to measure different sexual and reproductive health indicators in these settings, of which 25 were designed specifically for humanitarian settings, as a number of tools are maybe generalized to LMICs or even larger contexts and were applied in the humanitarian setting. In terms of specific indicators, we found a large representation of gender-based violence and pregnancy continuum indicators, so those related to antenatal care and delivery especially. Though there were several gaps in measurement we identified within the health, which were abortion and gynecological and menstrual health really were not consistently measured across studies or as included in the toolkits that we found. And then for our second review, we also conducted a scoping review for gender equality and women's empowerment, which is the publication that Jessica is sharing, which has recently been published in Conflict and Health. We retrieved 170 publications and reports. So it was overall a smaller review than the first, which was to be expected. We extracted indicators categorized into 7 domains for this. So we had our economic indicators, our health indicators, human development, leadership, psychological, security and justice, as well as sociocultural. We found toolkits as well for gender equality, but there were much fewer than for sexual and reproductive health, and they were more focused on gender-based violence specifically, as that topic really spanned both reviews. So there was a lot of representation of indicators really related to security and violence in terms of gender equality and women's empowerment, but we found much fewer in terms of economic, human development, and leadership indicators. And those that we did find, there was a greater representation in great literature. So not a lot of publications about, women's autonomy and leadership and, development, whether that be education or job skill development in humanitarian settings. So with all of our findings from both the 2 reviews, we created an interactive Tableau dashboard. And Tableau, it allows you to create a storyboard sort of narrative with all that you've found. And so what we did is we made, and Amanda will explain this in a bit, different pages about all the toolkits that we found, indicators, and measurement methods as well that could be sorted. So whether that be, cross-sectional studies, other interventional studies, etc. Another aspect of this lab is that we conducted 2 pilot projects. So the first was we developed a machine learning software, because during the process of conducting 2 scoping reviews, we learned that it can be quite a tedious and long process, especially because everything needs to be screened in duplicate, title abstract, and then you have to full text screen. So what we've done is created a machine learning software that uses algorithms to learn how the reviewer selects articles and what's included and what isn't, as to speed up the process, because then it can rate the most related titles. Our second pilot was a secondary analysis using logistic simplification and data reduction of some SRHR indicators in DHS surveys. So we really wanted to see if we could reduce the sampling fraction of households and enumeration areas to still generate valid estimates of these indicators, and if we could use more simplified versions of the indicators to ask less questions. And really, we found that it's possible to reduce the sample size while still getting accurate or valid measures of some of these larger indicators. So that's just the big overview of everything that we've done in this lab. So what I'm going to do now is I'm going to share my screen and show the dashboard, and Amanda is going to talk everyone through it.
All right. So we'll just give it a second to load before I start explaining what it is that you're seeing.
And I'll just note as we're doing that too, as we discussed, we will share the link to the dashboard a little bit later on. We'll just do it after this overview to avoid any crashing of the dashboard as people flock to it. But don't worry, it will be forthcoming in the links for you.
All right, so thank you, Jessica. Now, as you can see here, you start off on the project overview page. And although Celine has given you an overview of our project, I'll just reiterate that we were looking to capture the tools, methods, and indicators used to measure sexual and reproductive health and rights, and gender equality and women's empowerment in humanitarian settings. So these two major concepts are contained within this single dashboard. So it's interactive, and I would say it's pretty user-friendly. But if you needed some instructions, you can actually just click on the eye icon that's found on most pages of the dashboard. It's not on the acronyms page or the studies list page, but all of the truly interactive pages have this icon. So now we'll just go through a few of these pages in detail to give you an idea of how this dashboard works. So why don't we click on the toolkits and surveys page, Celine? Let's give it a second to load. All right. So I may be a little biased, but I think that in using this tool, you can actually access a lot of information really quickly, and it requires very little initial input. And what I mean by that is that, while you may know exactly what it is you're looking for, and you can filter using all of these items, so topic, country, humanitarian setting, data level, measurement method, and recommended sampling methods, you can also just search for one of these things. So I wanted to note that in terms of the country search, however, you can also go to the map that's over on the side, and you can search that way, and you can see which tools are associated with which countries, and then just click it again to deselect. All right, so let's illustrate this with an example. Celine, could you filter by topic? Let's say safe motherhood, because that's a really high yield topic. Give it a second. All right. So these were all of the toolkits that were used to measure the topic of safe motherhood. And you can see that some of them are humanitarian specific and some are not. Let's go to one of the humanitarian specific ones. So Celine, could you please click the CDC Reproductive Health Assessment Toolkit for conflict affected women? That is a mouthful. So as you can see, you can decide how you want to view this tool. So you can go to the tool source, as Celine just has, and we can go back. What you can also do is hover over the X, and okay, perfect. And that'll just show you some of the data associated with the tool. So in addition to safe motherhood, this toolkit was also used for some other topics. And we can't really zoom in, but if you were to go around and play with this tool, you can see all of the topics. You can also see the population types that were associated with this tool. So it's really great. It gives you a snapshot of what was found for this. All right, so let's head over to the scales and checklists page now. All I wanted to show you here is that it's set up in the exact same manner as the other page that we just looked at, and it operates identically. So you can click through it, you can find particular data on one scale or one checklist, and you can also head over to the map and look at the country-specific scales and checklists. Okay, so the all SRHR indicators and all GEWE indicators pages are also set up identically to one another, and they operate in the same way. So let's click all GEWE indicators, which we're at right now. That's our main focus today. So what we did is organize this page how we organize our paper. So by domain, indicator type, and subtype. And the domains can be found in this pie chart, which is representative of the proportion of studies found under each. So for example, if we hover over the social cultural domain in the pie chart, we can see that 80.6% of the studies included in this review contained indicators under this domain. Now, if we actually click on the social cultural domain, we will only see the types and subtypes associated with this one domain. And the numbers off to the right tell us how many indicators were found for each of these types. And then we can click on the type and we can see subtypes within them. So this is how we organized our paper. We thought it was easy and efficient to organize the dashboard in the exact same way. And if you want to find the indicators associated with each of these subtypes or types, all you'd have to do is go to the study indicators list page, and that contains everything that you need to know. So this is our dashboard, and we definitely encourage you to check it out after this. And we will note again, though, that if multiple people are using it at the same time, it will kind of flood the system and it might lag a little bit, but I would say be patient with it because it is definitely a great tool.
That's wonderful. Thank you so much, Amanda. And just as a reminder to folks as well, if you have specific questions about the tool, please do post them in the Q&A. And if we don't get to them in this session, we'll definitely follow up. As well, in addition to this recording, you've also produced another shorter recording that walks through the tool as well, and we'll be making that available so that folks could have it as part of their reference list after this conversation. But what really strikes me in all of this, of course, is the amount of in-depth review that you did as part of this work, and that the one of the key outputs of this has been to synthesize this in an effective and useful way so that researchers and evaluators can, quickly go and look at the literature that's available and that's most applicable to them. And this is really important, we know, because Canada has made its 10-year commitment to health and rights, and so we know that increasingly a number of initiatives are coming online that are focusing not just on health systems or delivery, but on that and the intersections of human rights related issues. So I'm wondering if any of you can speak a bit to some of the specific challenges that you noted when it comes to measuring gender equality and rights issues, specifically in humanitarian settings. And if I can add a kind of a wrinkle to that, are there issues of gender equality and women's empowerment that are uniquely challenging? And if so, kind of what are they?
Yeah, so I can speak to this, Jessica. I'm just going to speak generally first, because I think the difficulty in measuring gender equality or rights issues comes from the difficulty in defining what it is. And gender equality or rights issues are very nuanced, and contextual factors will play a key role in knowing what to measure. So the equality and rights issues that you are looking to capture in a humanitarian setting will differ from non-humanitarian settings. And similarly, what you might measure in a low or middle income country is not what you will be measuring in a high income country. So to give you a very concrete, very simple example, in a high income country, you might measure the number of women in senior positions in science and technology fields as a proxy for equity in the field. But in contexts where access to even basic education is limited, this indicator is really far out of scope. So it's difficult not only because we are looking at the intersection of two contexts. So, we're looking at layering a humanitarian setting on top of a low and middle income country, but then under the umbrella of rights, we're looking at specific rights. We're looking at gender and equity, so it becomes even more specific. So in many cases, we actually saw that the measurement of basic human rights was prioritized. So things like access to food, shelter, water, and the gender piece only really came in disaggregating these indicators by sex, but that doesn't really capture gender. That's capturing something else. So the other thing that was overwhelmingly represented was gender-based violence, and Celine spoke to this, and that makes sense because gender is embedded in the term itself. But I want to circle back to disaggregating by sex. I think, over a third of the indicators in our study were disaggregated in this way. So comparing females to males and how they fared in terms of specific indicators. But our study was on gender equality and women's empowerment, and we employed gender and women very intentionally. We use the term women rather than females to ensure that people who identify as women but were not assigned female at birth were included in this review. But in the publications that we found that came out of our review, these terms female and women were used interchangeably. So that's not to say that the literature on women or on gender doesn't exist. It didn't come up in our review. It's possible that NGOs are working on gender specific issues and just not publishing it in the places that we were accustomed to looking for this information. The other thing that I wanted to mention is, gender identity is a very sensitive thing. And in an already vulnerable context, such as a humanitarian setting, you might be exacerbating the anxiety that one feels by asking questions around this. And some topics related to gender and sexuality might also be very taboo or even criminal in some settings. And how we found this manifest is basically in the absence of indicators pertaining to LGBTQ+ people. So really, we found, I think, Celine, 3 indicators that pertain to LGBTQ+ communities, and they were extremely simple indicators. It was really awareness of individuals belonging to this community, and then acceptance of individuals belonging to this community. And so, for holistic change, we're going to need more nuanced indicators than this, and more of a focus on these types of indicators. And I also want to speak to the empowerment and equality aspects of our study. So this is very challenging to measure as well, because there are many ways and levels in which to measure these two things. Empowerment, for example, can refer to your agency, but it can also refer to the resources or the tools or things that you use to make choices. And, further than that, it can also refer to your achievements. Previous research, however, has focused on the impact of gender equality and women's empowerment on maternal health and family planning outcomes, children's health outcomes, and SRHR. But while women's empowerment is a social determinant of these health outcomes, the measurement of GEWE in humanitarian settings can't just be approached from a biomedical lens. We need to move beyond kind of this framework. I understand part of the focus on this is because these are dominant issues in these settings. SRHR is definitely one of the predominant issues here, and GBV, for example, is another predominant issue in these settings. But in a protracted humanitarian setting, especially where people are spending potentially decades of their lives, we really need to approach things from a rights-based perspective and look at all of the needs. And again, this extends far beyond just SRHR and GBV. And finally, similar to the conversation surrounding, the distinction between sex and gender, there also needs to be a conversation around equality versus equity. So while our study did focus on equality, or the state of being equal, to be effective and sustainable, we need to go beyond this and try to remedy inequalities by addressing inequities. So I think that was very wordy, I'm sorry, but I believe that there are a number of different directions that we can go in from this study. And I think that, or I hope that a lot of research will come out of what we found.
Thanks, Amanda. I want to, maybe continuing on that. One of the questions that we got in advance of this webinar was around, what does the literature say around measuring awareness of rights among communities? So just, you talked about some of the places where we lack measurement tools or solid indicators. Curious to know if you came across in your work any information around this idea of awareness of rights, and if that was an area where there was or was not a lot of available evidence or research.
Yeah, so I can speak to this, and then Selena and Diego, I invite you to kind of add to this. But I think it's important first that I'm just going to acknowledge my positionality here and how I view rights. And so I associate rights with legal rights. And in our review, that the domain that kind of captured legal rights was security and justice. But measurements within this domain really just focused on the prevalence of things like abduction. They also looked at locations of violence, perpetrator information, so skewed more towards that security piece rather than truly the justice piece or awareness of rights. Systems related topics are noticeably absent. So things like laws that protect women or legal violence, access to the justice system, these aren't really measured in, or at least we didn't find these measurements in our review. They didn't come out. And one could argue that there is no need to measure legal violence in a setting or in a context where access to the legal system isn't there, right? So that one depends or predicates on the other. But I will note that if we measure these indicators in these settings, that could actually serve as a catalyst for developing systems of justice within these contexts. So if we measure that there is this lack of awareness of rights, perhaps that's a direction for implementation and a direction for NGOs to work in. So in the legal sense of the term, or in the legal sense of rights, not much, but the literature shows that rights are measured in different ways in these contexts. So overwhelmingly, rights were measured at that household level or at the community level. So is a woman able to decide what she does about her health? Is a woman able to decide what she does with her children, or what they're able to do, what things they're able to access? Is a woman able to participate in a community dialogue? So these kinds of rights, that was found in our review, definitely. And I think probably Celine can attest to this as well.
Yes, definitely there was a bit more of that aspect, as well as, perceptions and normalization of violence. So there was, the violence scales about, whether both women and men found violence, acceptable and in what circumstances. I think overall in our review, as we've mentioned, there was a big focus on sort of violence and security and sort of what had already occurred, and not necessarily what's in place to prevent that or to help support those who have experienced these things. It was very much sort of focused, many studies focused on basically reporting, what had occurred to women, or what the sort of outcomes had been, but not necessarily what their perceptions were, or how to, prevent that, or what systems are in place to support them.
And we've talked a bit, and about some of these broader challenges around measuring access and rights in these kinds of contexts. And Amanda, you talked about the fact that we're not always talking about a short-term or sudden onset humanitarian context. We might be talking about a protracted humanitarian context, but one of the questions that we received had to do with actually how we're constructed. And so in a project scenario, where that's typically how a lot of the intervention work is funded, on a project basis, which is fairly short term, even if it's within a larger scale or protracted conflict. The question came up of, how do we measure impact in contexts where we are constrained by short project cycles? Just curious to know if anything about the actual structure of program or project delivery came up in the research that you did.
Yeah, so we didn't get, what we did find is a lot of cross-sectional studies, taken at, one moment in time, reporting on, what had occurred, or what at that time point, what people's perceptions were. And I think we have very few interventional studies that really looked at, maybe making a change and then measuring women's empowerment, before and after, or their perceptions before and after. And I think that speaks to how challenging it can be to measure gender equality and women's empowerment in these settings, given how people are displaced and security levels change and how people are moving. And I think there definitely needs to be more interventions and that focus on these things, aside from just, the violence that I mentioned before. But yeah, overwhelmingly, indicators were cross-sectional at one point in time, and not really I think taking into account that, gender and gender behaviors and attitudes, they take a long time to change. And a lot of times to really see that long-term change is sort of, you have to kind of go past, a 1 year or 1 year project. It's something that has to be done, over time. And I feel like that's something, we need to adjust to. And I understand that maybe, we'll do a project for a year and you might not see these changes happen dramatically, right? This is something that takes, generations in some sense, in some cases. So I think it's also important that we have the mindset that, this is we have to aim for longer term things. And maybe Amanda, you can speak to that too, but.
Yeah, I honestly think that Celine said it best when she said we have to try to think beyond the short cycles that we're accustomed to, because generating change in this arena, in this area of gender equality and women's empowerment, it's going to take a long time. It's not a simple solution, and it needs to be approached from a lot of different angles, and that might require a number of different actors. I want to mention that it's obviously important to consult with the people that you intend to run these projects with and ensure that their voices are being heard, and they are also setting the agenda for these projects. And I think that will also, you'll see that in your results, that this will be only of benefit to you and your project if these people are consulted, because they definitely do know what is best for their community.
Absolutely. We at CanWatch, we recently produced a technical guidance note on measuring empowerment, women's empowerment in the global health sector specifically. And there's some great thoughts and resources available within that, which speak to the points that you've raised. But I think, yeah, the time, the focus on time that we often have within a humanitarian kind of setting adds another layer, and it's really important to consider how we're talking about empowerment within those contexts as well, and not just make assumptions about what is and isn't possible. And Diego, I'm mindful that you were having some technical issues, but you seem to be there now. So I don't want you to feel like I'm not bringing you into this conversation. So maybe you'd like to take a crack at my next question, if you can. And so we shared in the chat the recently published article you mentioned around empowerment. And towards the conclusion of that article, you wrote that with the onset of COVID-19, which of course, you were already working on this initiative before COVID came to our lives. So with the onset of the COVID-19 pandemic, women and girls are becoming increasingly vulnerable to the gendered impacts of conflicts, disasters, and epidemics. Therefore, it becomes even more imperative to have reliable, validated tools and indicators to measure gender equality and women's empowerment in humanitarian settings. So I was wondering if perhaps any of you could elaborate on how COVID-19 specifically is affecting measurement activities, or might, based on your knowledge and expertise, particularly in humanitarian settings.
I hope everyone can hear me. Can you hear me?
Yes, we can. We can, Diego.
And that you can hear, can hear me continuously, because that has been the issue. I've dropped, I don't know how many times. Worst internet day in 15 months. But so it has been a very sort of interesting and eye-opening experience to watch what happened to not only research, but even national data collection efforts during the pandemic. So we for standardized surveys like DHS and mixed surveys, they all stopped regardless of at what stage they were. So from training interviewers to active data collection, everything was on hold for a long while. I'm not sure if anything has restarted now, but that in itself will create a very large gap in data and knowledge that we'll see probably a couple of years down the line. It is a massive issue, because even when collecting data, we're probably going to have larger non-response rates, which will distort what we're doing. So I think we were sort of forced to think about something that has been always an issue and has bothered us, how in like effort intensive is data collection in all settings. But it's sort of like joining the roles of like humanitarian context to like now we're all in a major crisis, and the situation becomes quite similar, but now we have to adapt to like the whole world to this like new reality of how to collect data in this setting. So I think part of what we did with the, like due to our inability to pilot some of the tools as we planned originally in the collab grant, we moved to this, like, can we simplify data collection, sort of a new research question, right? And it has been very interesting for us to see this perhaps like possibility, not for everything, but for some indicators of like dramatically changing the even like the number of questions that you ask to get to a certain indicator, right? Like I think I don't want to say like we might have been overshooting for a long time, but I think we could do things a bit more sort of economically, let's say it that way, and perhaps without losing too much detail and too much sort of the confidence around estimates. Like it has been to me as a researcher very surprising to see that things do seem to work quite well with much smaller samples and much more sort of economic data collection modules, like trimming down a full module on contraception to one single question that is like highly correlated, like close to like 0.9 Pearson correlation with the full indicator, right? So it got us thinking and debating, like, why were we doing all of that? Like, is that sort of like something we inherited from a very academic perspective on data collection that perhaps is not necessary even for most of the things? So I think it kind of like brought this two universes of household and like population level data collection, and more of what civil society has been doing in evaluating and monitoring programs. And I think there's a place in between where we can meet and have perhaps like new creative solutions that can be used for different, like not only for monitoring, but also for like country tracking and population tracking more frequently than we do now with this like massive like mammoth that are like this national surveys that cost of millions of dollars and take years to implement, like from planning to having the data available. It's like no less than 2 years. Like maybe we could do things differently. So I think for me that has been very eye-opening, and I'm not sure if I answered your question properly. Like you had like a women's and girls angle there, like, but I think it sort of covers like it can be used, and what we did for this project was look specifically at sexual reproductive health and rights and gender equality indicators that were already available, and to see if we could trim it down, and it seems feasible. So I think we can move ahead this barrier of it's very complicated and you need to spend an hour with a person to fully assess what's going on in some aspects. I think it can be done much more efficiently, and I hope to sort of like opens the way to thinking differently about data collection.
No, thank you, Diego. And I think absolutely this point around, doing more with less, streamlining, using available data where we can, you're thinking critically about what we're collecting and why. These are things that have emerged again and again and again and are true of how we're talking about evaluation generally, and just noting that within the context of your article, you specifically talked about how it's even more imperative to have these tools and indicators to measure women's empowerment in humanitarian settings. So I guess maybe my follow-up to that would be, in looking through a lot of the tools and the literature that's available, I don't know if you feel you can comment on this, but to what degree is what is currently available helpful in this regard, Or is it that we really need to be building more, creating differently, sharing the tools and best practices that are available to meet the realities of doing more with less and being more efficient and streamlined? To what degree is what's out there fit for that purpose, and to what degree is it not? I'm not sure if you feel you can comment on that, but I'd welcome thoughts from folks.
Yeah, I think I can try a little bit, but Celine and Amanda are the pros in this. Like they know what is out there inside and out. My impression from the work we did on this sort of like two parts of this project of looking at SRHR and gender equality and women's empowerment. It's almost like there's too much of there. There are gaps, and you see in the paper like that we highlight what the gaps are, but there's no uniformity, right? Like there's too many tools being used, which make it very hard to make comparisons. Many are used like at once or twice in the period that we covered in the review. So like not having a standard way of measuring things makes it less useful. When you think of the bigger picture, right? Like trying to understand the phenomena, we already have in the situation of conflicts, like a very strong contextual driver that will make things different, that has to do with like where it's happening, the nature of the conflict, the population that is being affected. But then you add to that like a different way of measuring, right? So it becomes very difficult to understand what is a consequence of measurement and what is a consequence of the actual event that is unfolding in the country. Like, I'm not sure, like Amanda and Celine, do you think, other than the glaring gaps that we have highlighted, do we need more? And maybe that's the
I think for SRHR, there are a lot of guides. There's the interagency manual, there's the CDC toolkit. There are a lot, I think, of defined indicators that we could apply to what Diego was talking about in terms of trying to reduce the number of indicators we're asking to get a reliable result. I think for gender equality, there's a lot less comprehensive measures out there, like especially what we found in our review. There was a focus on certain areas, but not a lot of comprehensive themes to gender equality and women's empowerment. And I do think that's important, especially when we're talking about the context of COVID. It becomes more challenging to measure. While at the same time, women are at greater risk, whether it's they're, quarantined with someone who is abusive, or they're taking on more caregiving responsibilities for children or those who are sick, and they're less likely to access, resources and services that they need. So I think that's, an important piece too. And I also think with COVID now we could apply this to other, security issues and during conflict, is that in some cases I've experienced this, and maybe other researchers and members of organizations here have done work over the phone using cellular phones to do surveys or to conduct qualitative interviews, and that's great if you're able to do that. But some studies show that women actually have less access to cellular phones compared to men in these settings. Like a study in 2 refugee contexts in East Africa found that women were less likely to have access to a mobile phone than men. And they were also less likely to be digitally literate and have literacy skills in order to use this technology. So that's yet another barrier to this sort of data collection. So I think for SRHR, in terms of what the indicators we have, I think there are, like Diego said, there are just so many different toolkits, and it would be really useful to sort of have to zone in on something that's a bit more comprehensive. And then for gender equality, I don't believe that all the indicators are really there in a toolkit yet and really as defined. And it gets a lot more contextual too, so that is an added challenge.
Yeah, I would just echo what Celine and Diego said. Essentially, like SRHR, I believe can be simplified down to one toolkit that is very comprehensive, because right now the toolkits that we have are fairly redundant. a lot of the same indicators come up across multiple toolkits. But with GWE, there are definitely gaps. And I think that toolkits would benefit from being expanded and moving into these areas. So things like FGC, things like economic empowerment and LGBTQ plus rights and awareness, that needs to grow. And I think that, again, like what I said earlier, some of these things are being measured almost at the expense of other things being measured. So if we could simplify one, that might also help us to solve the issues we have with the gaps.
That's great. Thank you. I have another question, but I want to go to one that we just received in the chat, which was wondering if your research covered settings of onset humanitarian emergencies, like floods, earthquakes, volcanoes, that sort of thing. And if so, were specific indicators developed to measure SRHR and GEWE, or did existing indicators and toolkits apply to measure these themes in these settings?
So in both reviews for SRHR and GEWE, the vast majority of studies in our search strategy, our criteria, we included all forms of disaster and epidemics as well as conflict settings, but the vast majority of the papers we retrieved were about conflict settings. So I think in the general quality paper, there may be about 20 specific to disasters, and the SRHR paper a little bit more, but within that, I would say the toolkits were generally for humanitarian settings as a whole, or maybe not even specific to that. There weren't a lot of tools specific to disaster settings. There were a few for women's empowerment, a little bit in terms of how to engage women after the onset of a disaster, but that wasn't very common throughout the reviews. It was majority conflict, post-conflict within 5 years, as well as we included studies where the population was in a LMIC, maybe not in a conflict setting, but had fled within 5 years from a conflict. So for example, many in Kenya or Uganda who had left a conflict somewhere else to be a refugee. So overall, not a lot of representation from disaster settings.
And do you have any thoughts on that? And about the need for or the utility of kind of that differentiation in toolkits or in the literature?
I think that there needs to be a differentiation because these settings will require different resources as well. And like in terms of even building back and the infrastructure that's required and perhaps how to empower women when it comes to natural disasters and rebuilding, I think that indicators will be more specific when it comes to those toolkits. I also want to note that in terms of epidemics, because we did look at 3 different types of settings and epidemics was one of them, there wasn't much there either. And now with COVID-19, I'm sure we're going to see an influx of toolkits on this particular type of humanitarian setting. So I'm very interested to see what things emerge after this.
Yeah. And the other thing I wanted to add was that in our study, the disaster had to have already, occurred and been of a certain level of severity to be included in the study. So I did find some great literature, that did come up in our search that was about preparing women for the onset of disaster, maybe not actually a post-disaster setting, how to engage women in, survival strategies and how to prepare their communities for disaster. And that's a very interesting area, but because of the way our study was structured, those didn't all get included. So I think there is some of that literature out there too that is worth exploring.
That's great. Thank you very much. I do see that we have one other question here in the chat, or perhaps multiple ones. So maybe I'll flag both of them. So one of them is whether the indicators take into account social services other than health. And then another kind of follow-up question wondering, or just, I think maybe more of a statement about whether you'd be open to presenting the findings and the tableau at the IASC Gender Reference Group. So flagging that, thank you very much raising that. I think, I mean, I'll let you guys speak to that, Julie, but I think, yeah, the more places that these resources can be available, the better. But do you have any comments to this question from Jean-Marie around whether we were looking at social services other than health?
We were in a gender equality review. Not many did come up. There was, some element of social support networks and who women, went to, but there wasn't a lot of social services captured outside of, really a health setting. So that's, I think, so important, but that didn't come up very frequently in our study. But I think it's really important.
Very interesting. And yes, if folks would like to follow up with you about engaging at the IASC event, what should they do?
I can put my email in the chat if that helps, or I can send my email. That sounds great.
Thank you, Julie. And as well, if folks are interested in exploring more, feel free to connect with us at CanWatch, and we'll put you in touch. Mindful that we're coming up at the end of our hour. These hours always go very quickly. I'd like to kind of conclude as we are whenever we're talking about the collaborative is this idea that it isn't just about finding the definitive answer. It's often about figuring out what are the next questions and continuing to move forward in our learning. So and in your article you talk about the importance of having strong frameworks. So I'm wondering if perhaps three of you would like to share thoughts on where do we go from here, based on the work that you've done, the resources that you've gathered. What is needed to develop these strong frameworks? What are the next big questions that you think are next big data challenges that we need to be tackling as a sector?
Yeah, I think that's a very important question. And that was something when we were writing this review, we wanted to cater our indicators and really sort of map it to a framework. And we really struggled to find a framework with which to do that. I mean, there are a number of gender equality and women's empowerment frameworks that are a bit more, like Amanda spoke to earlier on, for a higher income setting with indicators about women's representation in certain fields, and those aren't necessarily very applicable to all humanitarian settings. And then we looked at a few other frameworks that maybe had a very economic focus or solely empowerment, but it was really hard to find something that captured everything, all these different facets of gender equality we wanted to explore. So the economic and the human development and the leadership and security and justice and psychological, all these different facets. It was very challenging for us to find one. So I think that is definitely an important next step, is to sort of, there's some great resources for a comprehensive sexual and reproductive health guidelines like the Interagency Manual and the CDC. And it would be really beneficial to have something like that for gender equality. And it is very challenging because it's so contextual. All of these different measures, they vary so much, like even within countries, there's so much variation within different populations and how to measure it. And so it's definitely a huge challenge, but I think it would be, even if it was a broad comprehensive framework, I think that would be really beneficial and a good next step. And I think trying to capture all of these different areas of women's empowerment, gender equality, while also being more inclusive of different gender identities too. I think that's really important, as Amanda had touched on before. Sick Kids held a workshop where they talked about women's empowerment. And towards the end, I know they're working on a paper about empowerment that sort of talks about a framework that includes, interpersonal agency and collective agency and structural agency, and sort of puts them all together and looks at it all from different types of agencies. And that's interesting. That was too late, into our study for us to really try and apply that. And that was much more empowerment, not necessarily the gender equality piece, but that is an interesting framework to look at. So that's hopefully something that we can look at in the future too.
For sure. And Diego, to make sure that you're brought in on this as well, what you mentioned this a little bit or alluded it to in your earlier question answers around COVID, but from you and your work in the lab, where does this point to you in terms of where we need to go next? What other big challenges or questions are top of mind for you?
Yeah, I think that this gap in the sort of the origins of I don't know if that's even a word, like the disempowerment, because I think girls are born empowered and they lose it, and they lose it very early in some contexts and much later in other contexts. And there's some studies that show this, that it can take a few years when you transition through school years to sort of like start like the constant aggression and the constant like undermining, like losing that agency happens. So because I'm like from a public health mindset, I think understanding where we lose it can be very enlightening. And I think that being able to measure that, and we didn't see any tools like other than like there's some studies that try to capture this issue of agency very early in life and try to understand when it starts cracking and falling apart in different contexts. Like I think more work in that area will be extremely informative and will allow us to think differently about policies and programs that can help support and ensure empowerment is strengthened and maintained, because I think that's an easier approach than trying to flip things around and empower when it has already been lost, right? Like I'm a believer in that we could perhaps gain much more from prevention, and that's a huge gap in research, like how to measure it early in life.
Thank you, Diego. And Amanda, I want to bring you in to make sure that you also have a chance to say a final thought on kind of where we go next. And if I can add a little kind of wrinkle to it, we did receive one final question. So maybe if you're able to throw that into your answer, it'd be great. And the question had to do with, I think a really important one about age, and wondering if within the work you uncovered any data that really disaggregated, not just in terms of gender, but also looked at different ages, whether that be adolescents or children or women of various ages. So just curious to know if that was an element of it. So would love if you have an answer on that. But more broadly, final reflections from you on kind of the big questions that this raises and where you'd like to see us go next.
Absolutely. So I'll address the second question first. In terms of age, we did actually disaggregate within women of reproductive age. According to how the studies disaggregated it. We had our own criteria, but a lot of studies said this is the age category we were interested in. And so if it fell within the 15 to 49 age group, we included it. I think in terms of next steps for research based off of what we found in our scoping reviews, I think because of this kind of dearth of data on natural disasters and those kinds of humanitarian settings, I would like to see more of an acute focus on climate change and climate refugees and the toolkits and indicators for women's empowerment and gender equality in those settings. Because I think that we're going to see that this becomes a bigger issue in the next few years. It's already a big issue. And I just think that it's understudied, and we should not only look at what do we do after these people become refugees from climate change, but also what can we do to make existing systems stronger and more resilient to climate change, and how can toolkits and measurement in these settings assist us with that?
Thank you so much, Amanda. Thank you, Amanda, Celine, and Diego, for being here today and sharing these interesting insights from the research that you've done, this great resource in the Tableau dashboard. MIN will be sharing some links shortly, and we'll be making sure they're available on our website, but also for raising some of these really thought-provoking questions in terms of where we go next. So with that, we are at our hour. And so I want to thank all of you who've attended here, asked questions, or shared your insights. I want to thank my CanWatch team for the technical support that makes these events always go so smoothly. And I also want to acknowledge and thank our other 5 collaborative partners who have participated in this critical dialogue series, who've done amazing work over the last few years, just like this project has, raising lots of insightful questions, providing lots of useful tools and resources. It's been a really exciting project to spend some time and energy on tackling data challenges. And I'm just grateful that individuals like yourselves are spending the time and energy to really tackle these big questions. It makes us a stronger sector for it. And of course, a thank you to Global Affairs Canada, who supports this initiative through financial resources. We couldn't do it without you. And so we'll close with that. This webinar is recorded and will be available on our website, along with all of the links to the resources that we've provided. And feel free to access them there, or to contact us at impact@canwatch.ca with any questions that you have. We'll be sure to triage those appropriately. So with that, wishing everyone a great rest of their day, and look forward to talking with all of you soon. Bye for now.